I'm quitting being a good doctor. I grew up in Long Beach, under-resourced community. I became a doctor to go back. And today I'm giving you 7 reasons I'm quitting. 7 things the system does that makes being a good doctor almost impossible. Stay with me because this is about your care too. The AMA just released fresh data, April 2026, nearly 19,000 doctors across 38 states, and here's what it said. 41.9% of physicians reported burnout symptoms. That's down from 48.2% in 2023. So yes, it's improving. But job stress is still sitting at 42.9%. That means nearly 1 in 2 doctors wakes up every single day carrying a huge amount of stress every single day. Here's the thing about that decline. It's real. And it matters. But 42%, that is still nearly half of all doctors. And the number one sources of stress, ineffective electronic medical system, lack of leadership transparency, inadequate staffing, excessive administrative burden. Sound familiar? These aren't new problems, they're chronic ones. And I'm about to walk you through every single one, starting with the one that almost broke me. Good doctors want to listen, they want to educate, they want to connect. But most healthcare systems reward more patients per hour, faster visits, more billing codes. So what happens? You're forced to choose between what's right for the patient and keeping with the system. That tension has a name. It's not burnout, it's called moral injury. Moral injury is what happens when you know the right thing to do, but the system won't let you do it. And that's the number one reason why I'm quitting being a good doctor. But it gets worse because the number 2 reason doesn't happen in the exam room. It happens at 11 p.m. at the kitchen table. You know what doctors do most of the days? Not diagnoses, not exams, they click boxes. For every hour a doctor spends with a patient, they spend nearly 2 hours on administrative work, 2 to 1. And the number 1 complaint in the latest AMA report, ineffective electronic medical record systems that eat up physician time. We built technology that's supposed to help doctors, and it's doing the opposite. A lot of that documentation doesn't happen at the office. It happens after dinner, after the kids go to bed, in pajamas at 11 p.m. We call it pajama time. I've heard others refer it as whack time, work after clinic. I call it a broken contract. Because what happens when you spend more time documenting than healing? You lose the meaning, you lose the identity, you lose the joy of why you became a doctor. That's reason number 2, I'm quitting being a good doctor. And reason number 3 is the one nobody wants to talk about because talking about it feels like a weakness. Here's the paradox that nobody says out loud. The doctor who stays late, who answers messages at 9 p.m., who cries in the car after a hard case, that's the one most at risk. The research confirms it. The traits that make someone a great physician, compassion, professionalism, going the extra mile, make them more vulnerable when the system is misaligned. Here's what the data says about who burns out fastest. Physicians working with understaffed teams more than 25% of the time are twice as likely to report burnout. Twice. And it's the ones carrying the most, the ones who care the most, who are absorbing that load. The givers are the ones that are getting crushed. So the best doctors give more and more until there's nothing left. And that's the number 3 reason I'm quitting being a good doctor. But here's where it stops being just a doctor problem and starts being your problem too. I need you to hear this. Physician burnout is a public health crisis. When doctors burn out, here's what happens to you. More medical errors, lower quality of care, fewer doctors in clinics near you, and higher cost for everyone. And communities like Long Beach, under-resourced neighborhoods, you don't always have the luxury of picking your doctor. You pick and choose who's left. When the system breaks its best doctors, the people that pay the price first are the ones who already have the least. That is reason number 4, I'm quitting being a good doctor. Now let me show the data that tells me the system knows this and still doesn't want to fix it. From that recent AMA survey, they asked what was causing the most stress, and not surprising, you know what the top answers were? Ineffective electronic medical record systems, lack of leadership transparency, inadequate staffing, and excessive administrative tasks. You know what's wild about that list? It's the same list from 5 years ago. We know exactly what's wrong. The system just hasn't fixed it. It's wild to me. We have the data. We know the causes. We have the solutions. And we keep handing doctors a yoga app for a systemic fracture. Real solutions exist. Reduce admin burden, fewer clicks, real scribes, AI tools, smarter electronic medical records. Restore physician autonomy. Let doctors doctor. Team-based care. Spread the load the right way. Mental health support without stigma. No fear of losing your license when you ask for help. Meta-analysis, the highest level of evidence, prove that organizational change has significantly greater impact than asking to just be more resilient. That's reason number 5, I'm quitting being a good doctor. Reasons 6 and 7 are the ones that hit deepest because they're about identity and what happens when you lose it. Good doctors want to think, to adapt, to individualize care, but instead they face protocols over clinical judgment, metrics over meaning, administrators overruling clinicians. And here's a brutal truth, only 47% of physicians remain in independent practices. Medicine has been corporatized. Healing became a transaction. Here's a stat that keeps me up at night. 83% of physicians still find their work deeply meaningful. 83%. They love medicine. They love their patients. But only 45% feel their work-life situation is sustainable. Think about that gap. Most doctors are running purely on mission, not on a system that supports them. That's not a healthcare model. That's people sacrificing themselves and calling it a calling or a career. That gap between loving what you do and not being able to survive it, that is a definition of a broken system. That's the number 6 reason I'm quitting being a good doctor. And reason number 7, this one's the one I sit with the most because it's most personal. Let me be real with you. Most doctors haven't stopped caring. 83% of physicians still find their work deeply meaningful. They show up despite the paperwork, despite the quotas, despite the burnout because they care about you. And the system, it relies on that. It counts on doctors sacrificing themselves and calling it dedication. That's not a healthcare system. That's heroism being mistaken for a business model. I grew up watching my neighborhood run out of doctors, and it wasn't because they stopped caring. It was because the system used them up. And that's reason number 7, I'm quitting being a good doctor. 7 reasons, 7 ways the system breaks good doctors. Now, here's the turn. But here's the thing, I'm not quitting. I said I was quitting being a good doctor. What I mean is I'm quitting a broken system as if it's normal. I'm quitting staying silent while the best doctors I know burn out and walk away. I'm quitting the version of medicine that treats physicians like a machine and patients like billing codes. I'm not quitting because I love my patients and I believe in a better future. I still believe in the doctor who shows up at 7 a.m. because they care. I believe in the nurse who welcomes every patient with a smile and asks about how their family's doing. I believe in communities like mine who deserve world-class care. The system needs to change and we are the ones that need to make it happen. But the system needs to stop playing games with our health. If you enjoy this content, I have a video right here, I'll link it above, about why Americans are getting sicker. I appreciate you. I'll see you in the next one.